you talk to us a little bit about the Senior CHW Pipeline Project that you guys are doing in partnership with SEMHA?
Yeah, I got to tell you that this was a real blessing for us to be able to partner with SEMHA around community health workers. We do this through AmeriCorps. So we have an AmeriCorps program, and most people don't think of older people as being AmeriCorps members, right? But here we now have older people, AmeriCorps members, who have been trained as community health workers, and now they're able to support their peers out in the community. And we couldn't have done that, to the extent that we're doing it now without this sort of program. And where the CHWs come in is that they're able to take these supports and services out into the community. And they have learned how to listen and to observe. The cool thing about people that have been trained is that they themselves are also older adults too. So they understand kind of what it's like. They can better relate as well. The other thing I would say is really important, why we need to focus on older people in Detroit, is this really came to a head during the pandemic. In Detroit right now, you have more people over the age of 60 than you do under 18.
Wow.
So let that sink in. More people over 60 under 18. So for the most part, Detroiters have an average life expectancy that's about 10 to 12 years less than what you would find in the suburbs. And part of the reason is that many of us are living with chronic illnesses. And so when the pandemic hit, we found a lot of people in their 50s and 60s that were succumbing to the COVID virus. And no one really thought about, at least early on in the pandemic, no one really thought about this vulnerable population. And so it's really important that we have a lack of a better term, a workforce that can relate to the seniors here in Detroit and some of the surrounding communities and understand what they're going through, and can help them from anything of helping them to address their basic needs, such as shelter, food, clothing, those kinds of things, all the way up to realizing their dream to say maybe become an artist, right?
That's fantastic. Have there been any other unexpected benefits or outcomes from the program?
Yeah, I think it's opened up our eyes in terms of a lot of different ways that we can support seniors. And as I said earlier, I was going to talk about our why we emphasize art so much, but we really believe, and there was a longitudinal study that supports this, that older people who are engaged in robust arts training, that they lead healthier lives, they have fewer doctor's visits and fewer medications. So that's one of the reasons why we lean into that. So we try to meet seniors wherever they need, from those basic needs all the way up to actualizing their dream of being an artist. So I really believe that this program can really expand, because there are a lot of what we call solo agers. So solo agers are those older people who may not have a spouse, may not have any children or anyone in their family to check in on them. And so they're kind of left alone. And we isolate seniors all the time, out of sight, out of mind, because none of us want to ever get old, right? We don't want to see it. So I just think that this program has such tremendous upside. And that's why I said I think this is a blessing that SEMHA chose us to partner with you guys on this.
So how has SEMHA supported the Hannan Center through this initiative?
So the biggest way, I think two ways. Number one is that, SEMHA has sort of the idea, or sort of operates from the perspective of what's the word I'm looking for? Population health perspective. Looking at what does the population, what does this demographic need? And that helped us to sort of begin thinking about how can we have a more consistent and broader impact on the seniors that we serve. I think that what we have to do is to sort of tear down the narrative about older adults. Ageism is the last accepted ism. No one thinks anything is wrong with putting down someone for being older. We see it on TV, we hear it on the radios, we see it in the stores when we buy birthday cards, right? And we think that this is not harmful at all, when in fact it is very harmful. There are so many studies that point to the fact that people who have a positive outlook on aging, on average, live 7 to 8 years longer than those who do not. So 7 to 8 years by having a positive outlook. And you don't realize how insidious and how harmful these ageist beliefs can have on us, right? But one of the things it does is that it shames us. We don't want people to know that we can't do certain things. We don't want to ask for help. And so we suffer in silence, and in suffering, we may not get the help or resources that we need to have a better quality of life. So honestly, I believe the way we help seniors stay engaged in the community is to begin to break down this narrative about aging and recognize that there is as much sort of diversity and talent and potential between someone, say, that is 55 years and 100 years as people who are, say, under 30, right? But we don't classify people in their 30s in the same category as people in their teens. We don't do that, right? But we lump all older people together as if we're one monolithic group. And it's not true. So we just got to tear down this ageism and recognize the value and talents that older adults bring to this community.
So I just want to thank you for being a partner and an ally for Detroit area seniors, which is something that was told throughout. But thank you for being a partner for older adults in Detroit, and I really appreciate this time with you.
Oh, thanks, Arthur. I appreciate this opportunity to talk to you as well. Take care.
Thank you.